Hello, my name is Ian Miller and I'm the CEO of Presymptom Health. And Presymptom Health is developing a portfolio of products to enable the early diagnosis of disease. The company's products are essentially comprised of blood tests and predictive software to confirm the presence of infection and the severity of infection. And the latter question is directed towards whether an infected patient's disease is likely to progress to organ failure and sepsis. Now, the company has a unique opportunity in that it was founded to exploit a one-of-a-kind, fully annotated clinical longitudinal database, biobank. This biobank comprises 72,000 samples and there is a result of a multi-institution study over a 10-year period. Presymptom has the ability to go back to this biobank time and again to derive insights, as it has done several times already. In terms of development stage, we've already discovered our initial products. We have built prototypes to render them, and those are being deployed in a multi-site NHS clinical validation study called Precision. We've raised nearly 2 million, and at this point we are interested in partners for strategic development and also for future distribution. Our products will hit the market in late 2024. To tell you a little bit about our foundational biobank resource, this derived from a 10-year study, including nearly 4,400 patients, from which daily blood samples were drawn. There were 100 clinical and research collaborators across 8 hospitals participating in this study. And essentially, patients were recruited and daily bloods drawn across the course of their journey in hospital, which included surgery. So we have bloods predating the surgery. The patients who got infection from the selective surgery study would have got that infection at the point of surgery, and some of them developed the infection and sepsis in the days following. So we're able to track their journey and analyse the bloods throughout their typically 7-day stay in hospital. So having drawn these bloods, we're able to conduct transcriptomic and proteomic analysis on these samples and to undertake machine learning to derive insight from the progression of the transcriptome or the proteome in these patients. So in essence, we were training tools to recognize future events, future clinical deterioration. Our entry point is to deploy these tests in the emergency department. In that scenario, patients present at hospital with symptoms suggesting infection. There are nearly 2 million such patients per year in the UK. And the clinician is faced with some challenging questions as they contemplate the future course of the patient's infection. Do they admit the patient, or is it safe to discharge them, perhaps for monitoring in a virtual ward remotely? Or are they likely to have a protracted stay, perhaps ending up in the ICU? So the physician is really trying to better prognosticate the patient's future disease course. So in terms of the status of Presymptom Health today, we have a test portfolio, software-based. We've built prototypes. Those are being deployed in a clinical validation trial. We've also generated recent evidence in external cohorts, data cohorts, showing that we have very high performance in excess of 90%. We're looking for co-development and distribution partners to power our market entry by 2024. The schematic on the right shows the design of our clinical validation study, our primary clinical validation study, which is called Precision. We're well into the process of recruiting 600 patients across multiple NHS sites. And these patients have acute lower respiratory tract infection. Some of our patients have COVID. And we're tracking the journey of these patients in hospital while drawing daily bloods. which we were able to analyse for different clinical questions using different tests within our portfolio. From a validation perspective, we're then comparing the outcomes projected by our tests with the actual clinical outcomes. So this work is ongoing. We'll have an interim readout in 2022 and a final readout in 2023. We're interested in speaking with partners who'd like to join us in this journey and help us power the development of our genomic and proteomic products and ultimately bring them to market by 2024. Thank you for your time today.